This article tells a harrowing tale of how someone died before they could receive the appropriate treatment they needed because the health insurance would not pre-authorize the particular treatment he wanted. He had a disease. They pre-authorized a standard treatment that cost a certain amount of money. This gentleman decided with his own health that he would rather go through a different procedure and a different course of treatment that actually cost less than what was already pre-approved and pre-authorized. They denied that. They said he couldn't go and get that done. It was the same treatment, or it was the same disease that they were treating. It was just a different type of treatment that he preferred, that was less invasive, that was going to give him a higher quality of life. And because that wasn't the one that was pre-authorized, it delayed and delayed and delayed, and the man unfortunately passed away. This is an overwhelming indictment of our healthcare system and how it works with standard health insurance. When you allow health insurance, when you demand health insurance, let me put it this way, to cover everyone for everything, okay? When they can't control their costs, when they can't do medical underwriting, they now have to control their costs somehow. Health insurance companies do. And the way that they control their costs is by dictating what types of care you can get. That's how they now control their costs. They can't deny you coverage, but they can deny you certain types of health care and certain routes that you might want to go. It's a much more managed care system now, and that's a big issue. I myself, 40 years old, live in Indianapolis. I don't have a managed care health insurance program. I have private individual health insurance where if I get a diagnosis, if I get a disease, I can dictate what kind of treatment that I want. I don't need pre-authorization, and then I can submit it in. That's how health insurance was originally intended. But now that health insurance has to cover all these things and all these people and no waiting periods and all pre-existing, now the way that health insurance companies control their costs is by restricting which treatments are approved. So get yourself out of that system, get a private plan, and you can avoid a really sad tale like this.